You're not going to be 15 and 16 forever.
It's never too soon for a student to start thinking about what they want to do.
So many areas in a medical field you can go into.
If I'm going to become a health career, I have to be very determined because it requires a lot of hard work.
So you have to be a people person. You have to be able to communicate well.
There's something really, really wonderful about health careers, and that is the fact that it's as broad as your imagination can make it.
My mother was a major force, and her saying was she didn't care if I had 50 children. If it's something you wanted to do, you can always achieve it. But just because I had 2 children, that wasn't a reason to stop me from being a nurse.
Essie Bullock always wanted to follow in her mother's footsteps and become a nurse. But after having 2 children while still in high school, some doubted she would graduate.
If people know you want to succeed and you want to do something, somebody's going to be there to help you. So I did graduate from high school. Once you graduate, it's wonderful. I've made it through this. I don't have to go to school anymore. But wait a minute, you want a job. You want a job that's paying you $20 an hour with a high school diploma. It's not going to work. You need to focus on your classes. You shoot for an A, you don't fall too far from it. But if you are just satisfied with C's and D's, you need to kind of boost it up a little bit.
Okay, that's good advice, good A's and B's, but how do you decide if healthcare is for you? What are you going to be? Think about your personal qualities, your values. Do a personal assessment.
Do I like people? Do I like to be around a large group of people?
Am I able to do this? Do I have the grades?
Do I care for people? Am I a compassionate person?
Am I a hardworking student?
You have to be a people's person.
You want to make sure that you're not a selfish individual, that you're there to give.
People who are always helping, always like working with, always like taking care of, always, you know, this person's sick and I want to help, this animal's sick, I want to help, this person can't do this, I'm going to cut the grass, you know, caring nature, helping nature. Those are the people who do best in healthcare, no doubt about it.
Do I have those types of characteristics in my personality to make me want to go into the health career and stick it out?
If you think healthcare might be a match for your personality and interests, then go for it. Roll up your sleeves and get to work. Get some experience, volunteer, or shadow a professional.
There's something that is called a shadowing program that are in some of the high schools where they go out into the communities and visit area health facilities where they'll see health professionals at work and really get a good insight into what is going on here.
Yvonne George is a health occupations teacher at Warren County High School.
An example of that. They can talk to some of these health professionals to find out, how did you get into this type of career? What were some of the things you did when you were my age?
And I can't think of a better way to really begin to understand if this is something you like to do for the rest of your life, than actually see what's done. Get out there and work with somebody. Come work with me. I have 10th grade students come here to my office and work with me. Some work once a week for the whole school year. So I would encourage students to get out there and look for those individuals who are willing to take them on as mentors and work with them and let them see what they do. If you can do that with somebody you can relate to, there's some relationship, there's some rapport because of who that person is or who their family is or the cultural tie. That's a strong role model, much stronger than if there's no relationship.
Dr. Bell is a Native American physician. After medical training, he set up practice back home in Pembroke, North Carolina, working with children.
Listen to your heart, okay? Where's your heart at? Can you show me? That's a smart boy. Let's see what you sound like today. I grew up about 2 miles down the road here. I went to, all the public schools here. Graduated from Pembroke High School about 20 years ago. You take care of family members and watch them grow, and you feel like you have some input into their health. It's a real important role I play here. Not just as it relates to education, but spiritually, culturally. I'm a dancer at our traditional powwow, so kids get to see me do that, and I think it means something important to them.
Dr. Bell didn't always know he wanted to be a doctor. He talked to people to help figure it all out. He talked to teachers, his guidance counselor, and his parents.
My mom and dad were very supportive, and they were school teachers, and they always stressed education to me and my brothers. And I remember talking to my counselor one day in the 11th grade, and the way we used to do it when I was in this a long time ago was you used to line up alphabetically and go in and spend 5 minutes with the counselor. And I remember one day meeting with him and saying that I was interested in medicine, and he said, well, maybe you could do pharmacy. He just threw it out. And I wasn't even thinking about pharmacy. And so I kind of said, well, yeah, I can do that. And so I went to pharmacy school first. I knew then that that's not what I wanted to be, and so I went into medical school right out of pharmacy school. And so, yeah, I had the doubts, but I was willing to, give it a chance and sacrifice what I needed to sacrifice to reach that goal. I tell students, when I talk to high school students now, getting ready to graduate high school, I say, well, when I was at your stage and finishing 12 years of school, I still had 12 more to go. And it really, their eyes just bug out, and I tell them, I say, I don't tell you that to discourage you. I just say that, if you want to do things like become a doctor, you have to take on those challenges and say, whatever it takes to get to my goal, I'm going to do.
So here's one way to decide and plan for a health career. Talk to people. Get some hands-on experience. Get yourself a mentor. And draw out a timetable.